All right, welcome to the Healthcare Insurance Hangout. I am Joey Giangola with Giangola Insurance, and today I'm actually going to be flying solo, and it's just you and me for a little Obamacare show and tell. And primarily, what we're going to kind of illustrate today is the before and after picture of where health insurance rates are going now in a post-Obamacare world as to where they currently exist for at least the next month and a half, 2 months before the 1st of January, and to kind of examine exactly what's happening. And of course, we're going to take some questions as they come in. If you have a question you want to know something about Obamacare, please feel free to submit that. You can go ahead and do that by getting over to jingolainsurance.com/HCIH18. That's Healthcare Insurance Hangout 18. That's going to get you to the page where you can go ahead and leave a comment to let me know exactly what question you want to know. So, but before we get into that, for those of you who are unfamiliar with the Healthcare Insurance Hangout, well, this is again our attempt to help you put the health back in your health insurance, and we do that by focusing on the avenues connected to and related to it. And we do that by talking with personal trainers, doctors, nutritionists, anybody that can help improve your overall health and the performance of your health insurance. Today, we're actually going to get deep into the actual health insurance of it and really focus on the costs of healthcare reform, the Affordable Care Act, and what you can expect and what you need to know. Now, I've been kind of chomping at the bit, if you will, to do this hangout for quite some time, but finally got the information to make it a reality here and thought, well, let's go ahead, take some time, and do this right now. So I'm going to go ahead, share my screen. This is the first time I've actually done this here, so bear with me if I don't, if I mess up and it doesn't look right. But for those of you who are listening to this after the fact on iTunes or Stitcher, feel free to head on over to the site jingolainsurance.com/HCIH18. That will get you right to the video of this, so you can actually watch and see what I'm pulling up here on my screen. Of course, for those of you who are watching, if you do want to tag along through the audio version only, you can do that in iTunes and Stitcher. So let's go ahead and take a look at what is going on here. So what I have pulled up, you should be able to see my screen now. And we're looking at, these are going to be current rates, and I'm running them for myself right now. And the most important thing to keep in mind is this is where rates currently exist. What I'm going to do is I'm going to scroll down. We're going to use Medical Mutual as the example right now, so I'll go ahead and filter out all these other companies so we can kind of just focus in. And you see here we've got 4 plans with a range of deductibles. I'm looking at the health savings account plans because they are one of my favorites. And what you're seeing here is you've got the $2,500, the $4,000, the $5,000, the $6,000. And you can see very, very affordable prices here for a 29-year-old male living just outside of Cleveland, Ohio. And this is what it costs if I wanted to buy a health insurance policy today, assuming everything's healthy, nothing's going on, no pre-existing conditions. Now, that's obviously the big catch here, and where somebody who is in a position where pre-existing conditions are a problem, this isn't going to apply too much. But for those of you who it's not a big deal. I mean, even if this price were to be adjusted by 50%, you're going to see that it's still significantly cheaper than what I could buy otherwise. So let me go ahead, and I've got the rates pulled up for new plans that Medical Mutual will be offering on the marketplace starting January 1st of this year. So let's go ahead and bring this back here real quick, and I'm going to share my entire desktop with you. Hopefully, all right, that's going to mess up, so that's not going to let me do that. So we'll stop that, and let me see here if I can figure out a way to make this work. Let's see here. All right, the beauties of live TV. So let's see, we want to stop this. And we want, let's try this right here. Here we go. Yep, this is what we're looking at. Got it figured out here. And what we're looking at here, now this is the current, or excuse me, the new plans that you are going to have available to you. Let me go and bring this over and kind of zoom in a little bit. So what we're going to want to pay attention to, and where we're going to draw the greatest comparison, we're going to first start with the market HSA 6000 bronze plan. I'll highlight it right here. You can see $185.94 for me personally. And that's going to have a $6,000 deductible, 0% coinsurance, so meaning $6,000 is the most that I would spend for covered medical services throughout the course of a calendar year. And I would pay $185.94 a month to do it. Now, that is an unsubsidized rate. So depending upon where your income falls, it could potentially be less than that. Now, let's go back real quick, and we're just going to take a peek just so we're clear. So we're at $185 under the new plans. So let's go ahead and bring back our our other browser here and look at these plans again. So as you can see, if I wanted a $6,000 with Medical Mutual, a $6,000 HSA with Medical Mutual right now, $56.48 is where that price comes in. So there's a substantial difference in price. As you can see, we've been saying that the prices are going to go up for quite some time, and obviously somebody in my scenario, towards their late 20s, approaching 30, we're going to see it more so than other demographics, other age groups of people, as the rating limits that they put on the policies, or the prices, I should say, is going to back end or weigh it down more on our end than it is on the upper scale of the age range of those in their early 60s. So now where this all kind of gets mixed up a little bit is the actual subsidy part of it. So where we can figure that out is, and you're saying, well, okay, let's see what my actual income is going to be. So I'll get back to this example in a second, but go ahead and put in my zip code, and this is an estimated $2,014 amount. Now this is going to get a little messy on how they're actually going to collect this, but they're going to try and base it off of your projected 2014 earnings, which obviously they don't have yet, nor do you. But let's just use a round number, just an example of how this would work. So let's just say somebody that is making $30,000 a year. They don't have any employer-sponsored coverage available, just one person. Number of adults is 1. And let's just go ahead and put my age in there again. We'll say 29. And there's no children on the policy, so we'll go ahead and submit. So now you could see that somebody making $30,000 in Ohio, 29 years old, would be able to have $206 per year cover the cost of their health insurance. So that's going to go ahead and take that 185. So we'll just do some simple math here. $206 divided by 12 is going to take $17 a month off of my health insurance. So now if we come back and we look at our rate again of that $185.94, that's only going to take it down and not even make it close to what I could be paying on my own right now. I mean, it's actually more than triple what I would be paying, assuming all is healthy. For somebody in my age range, generally the case that rate is going to be pretty accurate. There's usually not too many medications or procedures that are going on that are going to adjust that price. And I think this is just very interesting to look at as the actual cost of it has increased significantly. And if your income is not putting you in a position to where you're going to qualify for enough of a subsidy, well, you're going to be in a little bit of a problem, be in a little bit of trouble. And that's where, I've talked about it in previous blog posts and videos. That's where, you still have a few days left, depending on which company you're with, to get in your early renewal for your current health insurance policy. So if you have a current policy, most companies are allowing you to extend that throughout all of 2014 for the most part, and essentially delay the effects of these pricing increases that you do see. Now, I mean, it's very tough to say what is going to work very, for your specific situation. Obviously, you have income variables that are hard to predict. You have plan choices and things like that. But this is kind of an overview, just a 160 foot view from above as far as what's going on, and looking at just some basic rates for an example. Now, what gets even more curious, and we'll go ahead and pull back. I'll pop back in here for a second. What really is more curious than anything is the fact that these subsidies are going to be such a wild card, and if you do or do not qualify for them, how that's going to affect what you're going to do, and it's possible that if you make more expected based on 2014 projections, you might end up owing them money at the end of the year as opposed to actually getting it. And that's going to have to take a little time to see how it plays out. I mean, we're going to have to do our best to see what we can do, to avoid those sorts of things from happening and prepare you the best that we can. But again, we're working off of incomplete information most of the time. So what I'm going to do is I'm going to pull up the subsidy estimator again. And what I'm going to do is we'll just use Streetsboro again. We're going to do somebody that makes $94,000. Do a family of 4, and we've got somebody in their mid-50s, we'll say. And there's 3 adults, so they've got a couple kids. We're going to do a family of 4. They have 1 adult child who's 21. They have another child who is 20 or under, and nobody in the house uses tobacco. So let's go ahead and submit based upon this information. Now, somebody could get a tax credit making $94,000 a year with a family of 4 of around $5,874 for the year. That's a pretty penny there. So that's 5,874 over the year. That's $489 for that's $489 for your health insurance a month taken off. And that's substantial. And if we want to go ahead, we can actually take a look at what that family of 4 would cost to insure. So let me go back here, and we'll just put in a family of 4 at those ages. And let's see here. 5, 21. Make that a female, and we'll say 20, and we'll make that a male. All right, so I guess I need dates of birth as well. Anyways, I ran this earlier, and basically what you're looking at, it's going to come around to about well over $1,000 a month for that family. Depending upon the plan, it could be north of $1,400, $1,500, and again, that's substantial. What you want to obviously pay attention to, and this is where it's going to get really tricky, is let's go back to the subsidy calculator. And if you were to go ahead and all of a sudden, let's just say you did a little bit better, I mean just a smidge better than what you expected, you made $1,000 more, that $5,000 annual tax credit drops to 0. So that's where it could be a potentially dangerous situation for you. And just $1,000 in income is going to give you a whole heck of a lot of incentive to actually make less money. Again, how's it going to work? I mean, this is the best information that we have available right now as far as the tax credits go. But this is an example of a couple in their mid-50s, making a decent living, right around $100,000. But if again, to show you again, from $94,000 annual income, that $5,874 annual credit that disappears at $95,000. So we're right at the limit. Even at the limit, there's a pretty decent subsidy available to you. So that's kind of it. I mean, the nuts and bolts of what is happening with the rates, with the plans. We can come back, and if we want to take a quick look at the plans in depth a little bit more, we can go ahead and do that. And let's go ahead and pull that back up, which I believe is right here. Let's see, no, that's not the right one. Let's see, we want Let's go ahead and get my information back in here. All right. So now we're going to take a look back at these plans again. You'll notice that there's not a significant jump in price from an HSA plan to a traditional copay plan. If you look at their Market Classic Gold rate here, $302 a month. And then if you look at their Market Classic 1000 Gold plan, $312 a month. And that's going to be your traditional copay plan. Now, normally we would see a lot greater gap in prices. Now, I haven't had kind of enough time to really dive into this and understand why this is happening, but generally you'd have more of a substantial savings going with this health savings account plan, putting that extra money, that savings aside to use to cover that higher deductible, that higher out-of-pocket. But you will notice, however, that there is a substantially lower out-of-pocket risk here for me, as this plan is going to come with a total price tag of $5,000, where this plan here is only going to come with a $2,000 total price tag. So something to keep in mind. Obviously, this information is still very new, and trying to digest it all is a little tough. But again, you can just take a look from our previous example of the Market HSA 6000 bronze plan, which was $185 under the Affordable Care Act, to something that I could previously purchase for myself right now, which we can see right here is again $56 for the exact same plan. So just a little illustration. Wanted to take a minute to show you this information. Obviously, there's a lot to see and do with these new plans. And if you have any questions, please feel free to let me know now. That would be a good time to do that, and be happy to answer anything that we do have. But just wanted to take a little time to sit down and go over this information with you. Just let you know this is what we're looking at. These are the plans inside of the marketplace from one company, Medical Mutual. And in Ohio, it seems like they're going to be one of the more attractive options available to you. That's something to keep in mind as well. But just a quick, brief overview of what we're looking at, and I was a little surprised at how much higher the rates were going to actually be than I thought they would, because we were originally talking 40, 41%, and again we showed you here in a scenario where it's actually triple. So pretty substantial. And the biggest thing is if you have something now, if it remains affordable for you compared to these new prices, you're going to want to hold on to it as long as you can. So make sure you do that. Make sure you take the necessary steps. And from what I understand, we still can't apply for these plans that we're looking at. I've heard the earliest is going to be around maybe the first or second week of November that this fiasco is going to be all sorted out. So kind of keep that date in mind as far as a time period to want to move forward with stuff, and actually maybe try again to apply for these plans with these subsidies and get that verified. So just a kind of a quick down and dirty overview of some subsidy calculations, some actual hardcore numbers of where we are at currently and where we're moving to. If you are in a position you don't have health insurance now, it is going to be probably in your best interest, if you are able to get it, as I kind of showed you, to go ahead and get that plan in and approved before the first of the year, as you will save yourself a potentially decent amount of money. And just note again that you will have to have health insurance at the start of 2014 or face paying a penalty of 1% of your total annual household income. So again, depending upon where your income's at, obviously the health insurance has the potential to be dramatically more expensive than that penalty. However, if it even comes close, you're going to be paying a lot of money for nothing, as opposed to paying a little bit more for something. So something to keep in mind is kind of what I've been telling a lot of people who are on the fence and say, well, should I just pay the penalty or buy the health insurance? Obviously, I'm always going to say buy the health insurance, because it will ultimately protect you from catastrophic financial loss as it relates to a financial emergency related to your medical procedures. So, but that's it. I'm going to close this down here. Quick half hour on these rates, these plans, what you're looking at, what you can expect. If you do have any questions, feel free to reach out to me afterwards. Email is always available, joey@jingolainsurance.com. But I do want to thank you very much for taking the time to stop by the Hangout today, and we'll be back obviously next Wednesday with more of your healthcare insurance needs here on the Healthcare Insurance Hangout. So long, everybody.
I've had a lot of people ask me to do a recording video such as this to explain the benefits and the features of the incredible programs that AWIS is putting out there. There's over 63 million people in this country with no health care coverage that we can help, and also those that do carry major medical HMOs and PPOs, how we're actually lowering their costs, helping them with their deductibles, and making it a little bit more comfortable for them to have the incredible coverage of AWIS along with their major medical plans. American Workers Insurance Services and Family Care, it is a licensed and registered insurance agency marketing comprehensive major medical and life insurance, through licensed insurance agents, as well as affordable association healthcare. That's what we do here. Plans with limited group insurance benefits marketed by individuals, companies, and organizations, licensed and unlicensed. There are 3 types of healthcare programs in the country. It's very important to understand what 3 types are available to us. Government, Medicare, and Medicaid, again, you have to be of a certain age and you have to qualify. HMOs and PPOs, which is most of us understand, Blue Cross, Blue Shield, very, very expensive, hard to qualify for, high deductibles, those types of things. And association healthcare, and that's what we are with American Workers Insurance Services, something I knew wasn't even available. I had no idea what association healthcare was, but found out that it's been around longer than the other 2 put together, where you can get discount plans and limited group insurance benefits for a very low cost, and that's what I'm going to be going over here in the next few minutes. Now, American Workers Insurance Services limited group insurance benefits are actually underwritten by all the major medical insurance companies like U.S. Fire, Hartford Life, Crum & Forster, which has been around since the late 1800s, all A-rated on the AM Best for paying their bills on time and paying your medical bills. And being a customer for about 1.5 years now, with a lot of my friends that have these plans as well, I've been able to utilize all of the benefits. In fact, saw one from U.S. Fire and Insurance on my roommate's desk the other day for $3,300 paid by U.S. Fire and Insurance. His son crashed on our motocross track and had to take him to the emergency room. So really incredible to be A-rated for all the people that we do business with. Also, our vendors and affiliates, again, companies that you've heard about like Quest Diagnostics, Presidential Life, U.S. Fire and Insurance, those types of companies are all our vendors. And the PPNI network, that's something that you might want to write down, ppnusa.com. We have a group of over 400,000 doctors that are in our network, all contracted at Medicare and Medicaid rates. We're able to give them business and then also make sure that you're getting the best rates possible when you need to see the doctor. So again, ppnusa.com, free to join our network, and you might want to recommend that to your doctors as well. Now, we all know that healthcare is in a state of crisis. It's the hottest topic in America, affordable healthcare. You can't turn on the news or the radio or anything without really having that as the topic, even at the barbershop or wherever you're at. People are talking about, having affordable healthcare. 60 million people in our country right now have no health insurance, and that number is growing. Again, over half of small businesses do not offer health care to their employees, and even the ones that do, most of the employees cannot afford to add their families on to their plans. So some of the, part of the family's insured, part of them are running around with no insurance. And insurance companies are reducing benefits. Regular major corporations are dropping their health care just to stay in the business. And, you have to make, over $10,000 a year just for your health care, especially those that are self-employed. Paying very high deductibles out of your pocket before you even can utilize your insurance. So a lot of different things that are going on here that are creating the crisis of why people don't have any health care today. Now, we do business in 47 of 50 states. The only 3 states we don't do business in are Montana, North Dakota, and Massachusetts. Right now, you're looking at a license. We are licensed in every state that requires a license. In fact, we are the only company in the state of California to ever receive a DMPO license to be able to do these types of plans in the state of California. Now, a couple things, unlike the other 2 types of healthcare programs, everybody qualifies. There are no Social Security numbers required. There are no health restrictions. So if you have pre-existing conditions, you are still accepted into our program. Plans are affordable to get and keep, and there's little or no deductibles. In fact, there's only one deductible on one of the benefits that we have that we're going to go over here in the next few minutes. Now, a few questions I want to ask you. If you go to the hospital emergency room or even to the doctor because of an accident, the first question they ask you is, do you have health insurance? Now, wouldn't you think that it'd be the best if they asked what was wrong with you but they want to know if you have insurance. And if you say no, how do they treat you? Not very good. You might not even get treated at all. And how do you feel about that? Well, if I have one of my kids with me and they're hurt and I don't have any health care and I don't have a card to pull out, man, it's not a good feeling because you're going to get sent to the end of the line for sure, even if they're going to see you at all. Now, also, when they eventually treat you and you go home within 30 to 45 days, you could receive a bill for $900, $2,000, $4,000 or more. How are you going to pay that bill? Over 50% of bankruptcies in this country are because of medical bills. With our plans, you're going to be able to have that card that you can walk in and say, yes, I have coverage, and we can definitely help you. So now let's take a look at three of the plans that we have, three of the most popular plans. Now, depending on what state you're in, they're going to all be a little bit different. Maybe a little difference in the price and a little difference in the benefits, because the ability to do bundled plans along with unbundled plans depending on state regulations. So we're going to look at in box number one is a $59.95 plan a month for a single individual, or $69.95 for a family. Box number two is both a single or a family, $99.95 a month. That's going to be the price. And box number three is $169 for an individual and $199 for a family. Now, the best thing to do is take a look at where you're at right now and just say, what's my budget? We can upgrade and downgrade at any time. There's no contracts. So you can just apply right online, and there's an 800 number for any questions that you have. And if you wanted to upgrade to another plan or downgrade 1 month because funds are tight, you can do that. So very, very simple to be able to do that. So let's take a look at the $59 plan. Again, $69 for a family. There's a one-time application fee of $100. And so the first month, if you're an individual, would be $159.95 and $59.95 from there forward. Now, in 28 years of being in business, Family Care, they've never raised the rate on a single member, ever. So if your rate's $59.95 and you keep that plan for as long as you keep it, that's going to be the price. So that you're not going to have those major increases that you're seeing with all of the other insurance companies that are out there. Again, a one-time application fee, and in the first 30 days, you're going to be able to utilize the benefits, the discount benefits that you see in blue. And 30 days later, there's a 30-day waiting period for the limited group insurance benefits to be added onto your program. So let's run down them real quick. You got pet care through our Pet Assure program. Pet Assure is one of the largest pet organizations in the country. It gives you 10 to 30% off your pet care needs, such as pet food or veterinary services. So you'll simply fill out the form that comes in your packet when you get it, send it in, they'll send you a card from Pet Assure, and you can use that and start saving money there. Legal services. We have attorneys on staff that'll give you 30-minute free consultations for any issues that you might have that you run into that you need help with. Again, unlimited amounts that you need them for different events that happen. Now, our hospital patient advocacy, this is probably one of the best benefits that you're going to have by being a member of Family Care and AWIS. And this is a professional negotiation department that negotiates hospital bills. Now, check this out. The best state in the country overbills the non-insured by 32%. The worst two states in the country, California and Nevada, overbill by 2,000 to 3,000%. So this is a professional organization that negotiates bills for you. In fact, I had a friend that joined Family Care with me, that his wife had a stroke, and they had a $60,000 bill in 4 days at UCLA. Now, this is a bill that they had before they joined. Now, because Kathy has a pre-existing condition, she's not going to get affordable health care anywhere, even if she can get it at all. So they came in, they submitted their bills to the PAC program, and they only paid $10,000 out of a $60,000 bill. So do you think that that was worth it? And that was a bill that they had before they joined Family Care. So our PAC program is incredible to be able to negotiate that down and help you with those large bills. Now, the emergency roadside assistance, again, that's a new program that we have, very, very much like AAA. So if you run out of gas or you flat tire, now the great thing about our roadside assistance is it can be used in all 50 states. So those 4 benefits you can use immediately as soon as you become a member and get your member ID number. Now, the limited group insurance benefits, this is incredible. The number one thing that I found that people are worried about when they have no insurance is an accident. So on a $59 single plan, a $69 family plan, again, that doesn't matter if you have 2 kids or 10 kids, it's going to be $69.95 for the whole family. And you get $5,000 in accidental injury coverage. So if I got hurt, I'm going to have $5,000 in coverage, only a $100 deductible, any hospital, anywhere in the world, and it will be covered. And that's from Fairmont and U.S. Fire Insurance Company. So again, $5,000 in coverage. Imagine how many people out there have liability insurance only on their car. Well, they can have this, and they can have coverage everywhere that they're at. $10,000 in accidental death and dismemberment from Fairmont U.S. Fire. $100,000 emergency travel. Now, what this is that this is a zero deductible, 100,000 emergency travel program that if you get hurt over 100 miles away from home, they'll airlift you back to where you need to be with 100,000 coverage. So if you're a family of 4, each one of you is going to have $100,000 each in coverage for that accident. We also have brought on Hartford Life, obviously one of the most respected companies in the insurance field. They brought in $15,000 in term life insurance, no questions asked, and another $15,000 in accidental death and dismemberment. So again, for $69 a month, you've got $40,000 in coverage if there was a catastrophic accident. You know, $15,000 AD&D from Hartford, $10,000 from Fairmont, and another $15,000 term life with no questions asked. Everybody is accepted. So that's our least expensive plan. Again, way under $100. You can't even go to Chuck E. Cheese with a family of 4 for that kind of money. You know, you go out to dinner to a decent restaurant. We went to a halfway nice restaurant the other day for my daughter's birthday. There were 3 kids and 2 adults, no alcohol, just dinner, and it was $73. So it was more than this, and I can get a health care plan for my family. Now let's take a look at the next one. We're gonna jump up to our $99 plan. Now again, $100 one-time application fee, all of the same discount benefits, but what we've done here is 2 things. One is we've added the $50 doctor reimbursements, the first one there in pink that you'll see, and that's 5 times per year per family member, and there's 3 ways to utilize this benefit. Number 1 is if you use an in-network doctor and the bill is $75, you'll pay $25 and the doctor will get reimbursed the $50. Now if you use an out-of-network doctor like I had to a few weeks ago, I went to the eye doctor and got an appointment, it was $56. Well, I was able to pay the bill, $56. I brought the bill home. I filled out one little simple piece of paper, sent it into the company. They're going to mail me back $50. So I was able to use that even with my eye doctor, chiropractor, anybody, and get that covered. So my doctor visit cost me $6. This one jumps up to $10,000 in accidental injury. So again, I can have an injury today, an injury tomorrow, an injury the next day. My kids could get hurt, and I've got $10,000 in accidental injury coverage, again with a $100 deductible. So that's our $99 plan, a very popular plan. Now our number 1 plan that I've been selling anyway, that people are jumping right to, is our Obamacare Deluxe plan. $169 for an individual, $199 for a family. Now what have we added here? We still have the $50 doctor reimbursements, $10,000 accidental injury, but now we've added a $5,000 critical illness. That's the bottom one there in the brown, and so you have $5,000 critical illness coverage. And then you have hospitalization, the 2 bottom boxes there, $300 per day, hospital, and $600 for ICU. Now, it might not sound like a lot of money, especially when you see the size of hospital bills, but when you see that they overcharge like they do, and you have the ability to utilize the PAC program, it's amazing what this company is doing for people. I'll give you an example. We had a gentleman in the hospital who had an accident, and he was in the hospital for 22 days. He was in ICU for 12 of those days. 600 times 12 is 7,200. He had another 10 days just regular in the hospital. That's $300 a day, another $3,000, and it was an accident. So he had $10,000 there. So he had a little over $20,000 in coverage from his $169 plan. Well, the bill came to $66,000. Now they submitted that to our PAC program, the Hospital Patient Advocacy Program, and they were able to negotiate that bill down to where it cost that gentleman $100. It cost him his deductible. Now also with these plans, you can utilize catastrophic only insurance. There was an incredible article in the Washington Post talking about how insurance is actually wrong. They try to put everything into one where you really should separate it. Carry a high deductible catastrophic only program, and you can utilize one of our association healthcare programs that will actually cover that deductible. So if you have a $5,000 deductible on your catastrophic program, then you can have a $5,000 critical illness over here, for $169 or $199. That $5,000 critical illness or $10,000 accidental injury will actually cover your deductible. Because currently people are paying, hundreds and hundreds of, and even thousands of dollars a month for major medical insurance, and they're not using it. Well, now we can split that up, get a catastrophic program only, and also have one of our association healthcare programs. Also the $50 doctor reimbursement. If you have catastrophic and you have a copay, you can utilize that to cover your copay. If it's a $10 or $20 copay, you could submit that form and they're still going to send you $50. And the average person sees a doctor 2 to 3 times a year. So those are 3 of the major plans that we have. It's very easy to apply for one of our programs. Simply get back with the person that invited you to take a listen to this recording and log into their site at http:// whatever their site name is, .awiscard.com. Choose the state that you're from, view the available plans. There'll be a drop down next to each one once you decide on what plan that you want. Pick individual or family and simply take the 2 or 3 minutes to apply and enjoy all of the benefits of American Workers Insurance Services.